The loss of dorsal height is a defining feature in many nasal structural anomalies. A low-set dorsal height disrupts the nasal contour, often leading to a flattened or concave profile. This compromises the 1:3 facial ratio, a key principle in facial aesthetics where the nasal dorsum should ideally occupy the middle third of the face. Deviation from this ratio can unbalance facial proportions, detracting from overall symmetry. Additionally, reduced dorsal height may precipitate collapse of the inner epicanthal fold, the delicate skin fold medial to the palpebral fissure. This collapse not only alters periocular aesthetics, but may also contribute to a widened intercanthal distance, further distorting facial harmony. The dorsal ridge's width, whether broad or narrow, is intrinsically linked to dorsal height. A wide dorsal ridge often accompanies a flattened dorsum, creating an illusion of nasal shortening and broadening. Conversely, a narrow ridge may exaggerate dorsal height loss, resulting in a pinched or elongated appearance. Both extremes disrupt the dorsal aesthetic lines, the subtle convergent lines that should extend smoothly from the brow to the nasal tip. Irregularities here create visual asymmetry, drawing attention to structural deficiencies affecting the aesthetic perception of the nose. Here, I will highlight two key approaches, mimicking an onlay spreader graft for a narrow nasal ridge and using a narrow overlying graft for a wide nasal ridge. First, let's explore the approach for a narrow nasal ridge. In cases where the dorsal width is insufficient, thread techniques can simulate the effects of an onlay spreader graft. By strategically placing threads along the nasal dorsum, we can achieve structural augmentation, improving the definition and symmetry of the nasal ridge. This technique enhances dorsal width without the need for invasive surgical intervention, providing a natural and harmonious nasal contour. Conversely, for narrow overlying graft for a wide nasal ridge, in cases where the nasal ridge is excessively wide, a narrow overlying graft approach can be employed. This method involves using threads to create a controlled narrowing effect, refining the dorsal shape and improving the proportion of the nasal bridge. By selectively positioning the threads, we can achieve a more balanced appearance while preserving the natural anatomical characteristics of the nose. The thread insertion starts with anesthesia application before the whole procedure. Local anesthesia is administered at the entry points to minimize discomfort and allow for a pain-free procedure. The anesthesia is applied strategically to facilitate smooth insertion of the COG threads. Then we go for the insertion of COG threads. A pilot needle or cannula is used to create a small entry point at the nasal tip, or radix. The COG threads, equipped with barbs for anchoring and lifting, are carefully inserted along the midline of the nasal dorsum. The threads are placed in a parallel or slightly overlapping manner to provide a stable and natural-looking projection. Adjustment and securing the threads. Once the threads are in place, gentle molding is performed to refine the nasal shape. The barbs on the threads engage with the tissue, creating instant elevation and contour enhancement. Any excess thread is trimmed, and the insertion site is cleaned. Post-procedure care. The patient is advised to avoid excessive facial movements and pressure on the nose for the next few days. Mild swelling or bruising may occur, but typically subsides within a short period. Follow-up assessments ensure optimal results and patient satisfaction. You may see the before photo on the left and after photo on the right. After the procedure, the nose ridge is higher with narrower nose ridge platform. The nose looks more 3D with improved central projection, just like we have put on some shading makeup that ladies usually do. In this clay mode, you can further appreciate the contrast of the before and after nose. And this is from another angle. You may appreciate not only the nasal ridge is improved, at the same time, the alae of the nose are also partially supported at the center and therefore becomes narrower as a tent effect. There's another case. You can see the improvement of the height, the smoothness, and the tip and alae relationship improvement.